Here's something you may find shocking, but the United States really doesn't have a private health insurance industry. We have a corporate insurance industry. So few people buy insurance as a commodity for themselves anymore. It's almost all employer-based, and therefore the employer decides who the insurance company is. We have private insurance for things like homeowners insurance and for auto insurance. Can you imagine if we gave those entities the kind of power and control over our lives that we give health insurance? Let's say, for example, we did the same thing for auto insurance. Your employer would provide you with your auto insurance, and they would choose, say, for example, that you have Geico. And once your employer contracts with Geico for you, you are given the insurance. And from then on, Geico can decide how often you get your car serviced, what kind of oil that you use, where you physically can get it serviced, who services it. Whether or not you get a new car is determined by Geico, and whether you qualify or not, which needed to be pre-qualified as well as pre-approved. How often you would get a new car. And of course, if you lost your job, you would lose your car because you didn't have car insurance. We would never stand for that kind of control over our auto insurance. Why do we tolerate health insurance having such immense control over our lives? I'll tell you why. It's because at least the consumer, the driver, is the consumer when we purchase auto insurance, but the patient is no longer the consumer when health insurance is purchased because the employers are purchasing it. I think it's time that we start talking about going back to true private insurance. Insurance is a commodity. It can be commoditized, it can be traded, it should be able to be bought by the person who's going to consume those goods, and that is the patient. The fact that employers put the patient so far away from their own health insurance and health care really is what's caused us to have this escalation of price and lack of control, and has allowed these corporate entities that are United Healthcare and the Aetnas and Cignas to become such behemoths. It's just insurance, though. It shouldn't have that much control over our lives. I think the public discourse needs to start talking about decoupling insurance from employment, making health insurance a commodity once again, and truly getting back to private insurance, because actually in other countries, such as Switzerland and several others, private insurance works quite well. But that's not the system we have here. Now, I've posted elsewhere about whether or not we should go to single payer or national payer, and you can look that up at the end of this video. But I will say this. Insurance should not have that much control over our lives. It's just insurance, and it should be treated like a commodity. We need to get back to truly having private health insurance and not corporate health insurance.